The most common liver cancers in India are hepatocellular carcinoma, which affects liver, and the hilar cholangiocarcinoma, which affects the bile duct, and intrahepatic cholangiocarcinomas. The people who are especially at risk for these diseases are people who are suffering from viral infections like hepatitis B and hepatitis C, and the people who are having chronic liver diseases, and people who are having metabolic liver disease like suffering from diabetes, hypertension, hypothyroid, and people with fatty livers, and people with high risk behaviors like drug abuse. Symptoms are different in different types of cancers. In hepatocellular carcinoma, you will be usually in early stages there would be not much symptomatic, but in advanced stages you will get pain abdomen, and you will get enough weight loss, and you will have very reduced appetite, and you will have weakness, and you might even present with jaundice. But in hilar cholangiocarcinoma, the main symptom with which you present is first is jaundice, then you progress to weight loss and weakness, everything happens. The liver cancer is usually diagnosed first by seeing clinically the patient symptoms and whatever they are undergoing, and next is the set of blood tests we will send, like tumor markers, which will tell us the exact tumor burden, and the third is the definitive test, which we do like ultrasound, CT scan, and MRI scan, and we usually avoid taking biopsies in hepatocellular carcinoma as its risk of cancer spreading is more and chance of bleeding is high. There are three stages in liver cancer: early, intermediate, and advanced stages. In early stages, if the liver function is good, we can go for removing the affected part of the liver by cancer. And in early stage, if the liver function is not good, transplant is the best option. And in intermediate stages, if we can downstage the tumor with the transarterial chemoembolization, with radiofrequency ablation and microwave ablation, and then go for transplant. In advanced stages, we either go for chemotherapy, radiotherapy, or we can go for immunotherapy, which is current standard of care. The best thing is to first prevent the disease from coming by following healthy habits and exercise regimens, and avoiding high-risk behaviors like alcohol and drug abuse, and vaccinating yourself for hepatitis B vaccinations to prevent liver cancer from coming. The next best option is to find it early and cure it as early as possible. That can only be done with regular health checkups through your healthcare professionals, and getting regular scans, ultrasound scans, and basic blood tests.